All right, it should be started.
Hello.
Hello.
Hey, okay, we're started. We're live. Fantastic. I'm excited about today's show. I am especially excited about today's episode 3 of the GeoAI podcast. And for a lot of reasons, right? We're talking about an interesting topic. We're talking about advances to geospatial AI based health risk analytics, but also because I get to think about something else for a while. I think everyone knows that the United States is facing a lot of different interesting extreme weather. There is snow in Florida and Louisiana and southern states that typically don't get snow. And this is accumulating snow, not just a light dusting. There are harmful wildfires in California, which we're certainly going to talk about for a second because we know entire neighborhoods, not just individuals and houses and families, but neighborhoods are being decimated. And in our area, where those of you who know us, Paul and myself, we live in Maryland. We are in the midst of an Arctic blast where we have sub-zero temperature, or sub-freezing point temperatures, right? Sub-freezing point temperatures. In fact, today, after the show, it looks like we might get up to freezing point in the temperature. Paul, how are you handling this extreme cold temperatures, which I know are worse out where you are in Frostburg than where I am closer to Washington, D.C.?
Yeah, thanks, AJ. Yeah, it's been pretty cold for me. The I have worsening factors because where I live, kind of up in the mountains, we don't only just deal with the cold, but it's always constantly very windy as well. So the actual felt temperature when you go outside, I think for today might be -3, like actually negative Fahrenheit scale. So not just below freezing, but well below freezing.
Well below
Uh,
freezing, yeah.
but
Yeah,
fortunately,
we've
I
had
haven't had too many issues. I'm a homebody for the most part, so I can kind of just stay home and just cry about my electric bill for my heating.
yeah. Well, we wish that were enough for us, right? So we got a burst water pipe because of the cold, right? So I'm sure something froze and then the water expanded and broke the pipe, and we're dealing with that. So I was telling Paul earlier, and wondering if the audience will be able to hear the air blowers that are running in the background to try to dry up some of the water that spilled out of the broken pipe. But if you can hear it, well, then homeowners will know, especially homeowners in winter states will know what that's about. But if you can't hear it, great. So we were a little discombobulated to get off the ground because that's what I've been doing for the past day. But I'm excited that now we are we're ready to talk about geospatial health risk analytics. But I do want to mention, you know, a burst water pipe is not fun, but it's really relative to what's happening in California. It's really no big deal, right? Or there they have at great imminent risk to their lives. People have had to leave their homes and lost their homes and all of their possessions and belongings. The wildfire impact there is spectacularly worse, and usually we think of it in the truly the wildlands area. In fact, wildfires are actually wildland fires. That's what we actually call them. Here, these are downtown. These are cities. These are very urban area fires, and that's a little bit of a different phenomenon, right, Paul?
That is very correct. With wildland fires, you do have different methods for trying to address and contain those fires compared to what you get in inner city fires or just kind of more residential or commercial fires, where they really do try to use larger bodies of water and different strategies that you would do for fighting buildings. So having the wildland fires in California kind of encroach into the residential areas and cause a lot of destruction, we've just seen that those are just really difficult to tackle from a logistics perspective.
Yeah, yeah. One of the things we did, Paul, you'll remember during the Maui fire a couple years ago, or maybe it was just last year now, 23, was that we did a healthcare infrastructure assessment for the state of Hawaii based on the fire to see what healthcare resources may have been damaged so that in the aftermath of the fire, they could make decisions around restoring those levels of service lines. We want to do the same for Los Angeles, for Southern California areas that are impacted. And I hear that even some of San Diego has been impacted by fires. But of course, Southern California is larger than Hawaii in almost every way. Larger geography, larger population, a greater healthcare infrastructure that can take on damage and may need to be restored. So this is something that we are looking for partners and collaborators and, supporters, financial supporters, to allow us to produce this report and make it available to communities, to urban planning, city urban planners, to health systems, to insurers, to the secretaries of health for those areas, to anybody who may be involved in restoring a certain level, the sort of the pre-disaster level of healthcare services that were available to the population in the fire disaster impacted areas. We'll post more about that on our website and our chats and our social media, and certainly want to try to be of service to the community as much as is possible. And now
100%.
let's get to today's topic, Paul. Obviously, we're a geospatial health risk analytics firm. We use a lot of AI modeling to predict future health risks, to help organizations understand what the risks may mean to, or how they may disrupt their operations, their assets, and the populations they serve. And in doing that, we have been toying with a lot of technology-based solutions that bring together geospatial and AI, large platforms, large data sets, machine learning algorithms, to do this risk stratification, both today and into the future. And Paul has played a critical role in developing the platform, which we call the GeoMD Platform. Paul, tell us a little bit about what the platform is and what this new version 4.0, is literally the fourth incarnation of the GeoMD Platform since we've been in operation, what this means.
Sure thing. Are you able to see my screen?
Yes, this is sort of the front page, or the main splash page for the GeoMD Platform.
Yeah. So thanks to Jay, and welcome everyone to the new interface and home of the GeoMD Platform, which, as Jay mentioned, is kind of our hub for geospatial AI insights and visualizations. So starting off, I would like to log in as one of our existing clients that we're currently doing a pilot with, and we will see what their custom analytics dashboard looks like.
Yeah, so as while Paul is logging in, let me just sort of explain that, right? So we provide this platform. The platform is fairly simple to use, right? The user convenience, user ease of use is fairly high. And obviously, when we start talking about generative AI, we all kind of know how to use that sort of conversational prompt-based approach, right? And with the platform, clients, users, individuals, they can use it on their own to assess their risks. But from time to time, we do work with organizations to develop specific solutions that may be of interest to them and interest to the market overall. Paul will talk about in a second, but this is a case where a specific heat health index, which is an impact of climate change and affects the whole world because the temperatures across the globe are rising, this is one that we wanted to ensure that this particular organization was able to use the solution, use the GeoMD platform to get solutions specific to their unique problems. Go ahead, Paul.
Yep, thank you very much, Ajay. Here I have logged into an account that we have set up for a pilot that we're currently doing with Broome County, New York, looking into, as Ajay mentioned, the health risk from extreme heat events. So taking on the role of a public health analyst at the Broome County Health Department, I can use this dashboard to identify where populations are more susceptible to heat across the county, especially with the map, where we have the greens that are identifying low risk, green is very low risk, blue is low risk, orange is kind of medium risk, and yellow is medium risk, and orange is the high risk. Additionally, through this table at the bottom, we can see some of the contributing social factors as a part of the underlying health risk indicator. And with the graph as well, we can see how each of those underlying social and environmental factors, how much they contribute to the overall risk for each of these specific zip codes.
Right. And so that shows the degree of, first of all, everything that you're showing is flexible, right? So
Yes,
individual users can configure the dashboard to respond to what their interests are, right?
that is correct.
That's something that we just want to make clear, because even within one client group, one organization, much less across different counties, different things are going to matter to different people. But what you're showing here, and this is something that's fairly unique about geospatial analytics in general, and certainly for us, is that the same causative factors of an outcome, whether it is heat risk or any kind of risk, are not uniformly distributed across an area. So if you have a county, then yes, there can be different reasons that different zip codes or different census tracts are at the same overall risk level. So not only do we share a risk level, risk of heat exposure is high in these zip codes, in these counties, or in these census tracts, but the specific factors that cause that high risk in each area. Because visibility into those causative factors is what's important in order to mitigate the risk at the local level.
Yep, as by identifying these specific factors, especially how they differ across um, their area of interest or area where they want to perform interventions, this allows for more targeted actions to be taken before, during, and after, in this case, an extreme heat event, but it also applies to um, other health related issues or challenges that our clients are looking to solve.
Great.
Awesome.
Great.
So, geospatial dashboards like this one shown here are, as we've kind of discussed, can be very useful for decision making. However, they can also be challenging to interpret without previous experience. And so, this is where Anna, our generative AI orchestrator in front end, comes in. I didn't update the permissions for this. Okay. I'll have to log into a different user. That is fine.
That's actually a good thing, right? So different users of the platform can have access to different solutions. So while we do have a generative AI front end, not every individual client necessarily needs to uh, pay license fees that involve access to it. You can certainly license just those specific solutions that are of interest to you.
This one will definitely have access. Okay, there we go.
Yeah.
Um, awesome. So, still retaining the hat of being a public health analyst in Broome County, I want to ask. Uh, actually, sorry, changing my role over to a public health analyst at the Florida Department of Emergency Management. I'd like to know what is the health risk from Hurricane Milton in Florida at the zip code level. And
Yeah.
sorry, go ahead, Ajay.
No, I was just gonna, as background, right? So we're changing streams a little bit, right? We were talking about heat risk at a public health level. Now we're sort of talking about disaster response activities, right? What are the health risks from a potential hurricane? Uh, we all know, of course, Hurricane Milton did recently hit Florida, but the same query could be asked by just saying, "What's the risk from the most recent hurricane?" And then the system will download the appropriate data from the National Hurricane Center or other sources of authoritative sources of information on storms and disasters as they're approaching.
Yep, that is very true. Various clients, as they have access to, or as they're granted access to Anna, are able to ask questions to Anna about our insights that we have already produce or have produced specifically for our clients, and as you can see here, are able to receive text responses to their questions alongside the geospatial visualizations, charts, and tables. And as you kind of saw, the response times from Anna do range from about 30 seconds to 5 minutes, as Anna's AI-based orchestration kicks off data pipelines within the GeoMD platform to, as Ajay mentioned, retrieve data, analyze the data, and then summarize the results back to the user.
Right. So one big difference between Anna and what we typically associate with generative AI like ChatGPT and the rest is that this is not just putting together text from its corpus of knowledge, which is the internet, through some sort of pattern matching on what words make the most sense together. Anna does that. It can do that capacity, but it is also actually running calculations. So it is calculating, running lots of algorithms, crunching data, and that does take time. It is not an immediate response. Obviously, the goal is always to increase the level of computational power and reduce the required computations to increase speed. That's always the goal, and we're certainly going to have more conversations on that in future episodes. But this is something that takes time to get the solution that is accurate and not a hallucination.
That is very true. To give a little bit of a description of what we were kind of seeing, as we can see on the right, Anne has provided a text response to the original query where it talks about the R Hurricane Health Risk Index, which is the primary indicator that Anna retrieved based off of the query, and that the scores range from 0 to 57. And it gives some of the summary statistics as well as identifying where the highest risk zip codes are, which is very valuable. And additionally, on the left, as I've been kind of showing a little bit as Ajay was giving additional info, we have the map visualization that shows both the Hurricane Health Risk Index as well as specifically the National Hurricane Health Risk Index. That's why some of these values seem kind of low. We do have a state version as well that looks just
So I know you don't have to say this, but it's obvious, but I think we should talk about it for a second. The green storm path is Hurricane Milton. That's humongous. It almost impacted the entirety of the state of Florida, right?
Yep, that is very correct.
Right. So when you put this in context, right, the visualization adds this element, right? We know that hurricanes are large storms, but it's hard to sometimes understand the scope of them until you see them on a map.
Yeah, these can be very large storm systems, and it's unsurprising the scale of the destruction, unfortunately, that they can bring upon impacted areas, which is one of the reasons why we want to have these indicators available for all sorts of disasters, as it does allow me, with my public health analyst at the Florida Department of Emergency Management hats, to drill down and gain additional information that can be used for resource deployments, personnel allocation, and just making sure that we are prepared to respond to the needs of the underlying populations based off of their demographic factors, economic factors, underlying health
and their
conditions.
Health factors. Yeah.
Exactly.
Yeah.
So as we can kind of see, we can filter by specific counties, which I will just filter for. I chose the county I can't pronounce. Alachua. That's close enough.
Alachua. Yeah, anybody from Florida who knows the exact pronunciation of the county name, please feel free to correct us, share with us, right?
Definitely.
So this is what I'm saying, that this Anna provides a dashboard, provides the answer to the question, and provides a dashboard, so that even if your prompt was not exactly what you wanted, or your prompt's response is not exactly what you wanted or anticipated receiving, the dashboard then allows you to capture the data and information that is sought. so that in this case, emergency response can make decisions, resource allocation decisions, recovery decisions, post-disaster recovery decisions, all of those kinds of things.
Yeah.
And
And sorry, go ahead,
we've
Ajay.
also done this for wildfires as well, right?
That is
Um,
correct.
we've developed disaster risk indices for a wide variety of disasters, so allowing the first responder community to uh, support the health needs of those impacted by disasters across hurricanes and wildfires and uh, storm surge and drought, and even to an extent flood, and now most recently heat. Yep.
Yep, definitely. Uh, so just a quick other. So aside from the map, we also have, as I've kind of shown, a pie chart that allows you to kind of see the distribution of the different risk categories, which can be very helpful, as well as again a table of the underlying data
Right.
that's used as a part that was retrieved as a part of the response. Can be helpful for digging deeper to gain valuable insights as well.
As well as performing reporting
Yep.
during and after the disaster response, right? So to some extent, the text response to the question plus a visual, maybe all that's necessary, can be exported quickly, sent right to first responders to direct, them on where to go. But the underlying data that informed that decision, that's available. That's can be saved, it can be exported, it can be produced in a report, so that after action efforts that want to assess how and why certain decisions were made, the supporting data is going to be available. It's not a black box, right? This is a solution that shows its work. It gives you an answer and tells you and makes sure you know how that answer was arrived.
Yep. And I know we do want to cover kind of what the future
We all like
capabilities
to look into the future. Yep, Paul,
the
that's right.
future capabilities of Anna are going to be. And we will cover a lot of that later. But to build off your points in terms of documentation, one of the features that will be coming out soon for Anna is a documentation of the provenance of essentially exactly what Anna did to give you its answer and the visuals that it's showing, what data it pulled, how it manipulated that data, and then how it arrived at its answer based off of the data manipulation that it did in the back end. So that sort of provenance sort of documentation will be very helpful, especially in, as you mentioned, the kind of more government use cases with stuff like after action reports. So you have confidence in where the data came from. You can go through, double check, make sure that you didn't have hallucinations or other errors in the data, and that you were able to kind of try to make the best extract the best insights that you could from the analyses that as they were presented.
Exactly right. So the risk of hallucination is, I'm sure, bad in every industry, in every field. But if you are really just using a generative AI like ChatGPT or Bing or anything, or Grok, just to do something on a personal level, like write an email, write a letter, maybe a hallucination is not such a challenging concept. But anything related to health and emergency response and really critical decision support space, you can't have things making up answers, right? It can't make up evidence on which to support a decision, and so that is a significant problem that we're working hard to find a way around. And I think by ensuring that the underlying data is presented is a long way goes a long way in doing that, as well as a number of other steps we've taken. It also helps with reducing error, right? This is, if it's running a calculation, then it's less likely that an error will pop up. But this is, again, all of these things are things that we see as an advance from our previous versions, and we're incredibly optimistic and excited for further reductions in errors and hallucinations in future releases of the GeoMD platform.
Yeah, definitely. Thank you for that. Thank you for that, Jay, and welcome, Rom. Switching over to a third client-related hat. Um, about a year ago, we did work with the Maryland Hospital Association to perform a care desert analysis within the state of Maryland, to looking at three different service lines so that they could use that information to identify where access to care wasn't sufficient so that they can provide arguments for funding for additional clinics in these areas. So, putting on a hat as a public health researcher at the MHA, as you can see here, we have a suite of our care desert analyses that we have conducted and that can be navigated to from either our solutions page that has highlights our key areas that we have performed analytics so far, as well as it can be navigated from the home page as well. So from our care desert page, I will navigate to the pharmacy analysis, and I will see that we have a story map, which is one of the ways that clients can see some of our public good analyses that we've done, kind of taking these data sets and indicators that we have and trying to identify interesting factoids or interesting relationships that seem to occur to get people interested in these sorts of analyses if it's related to solutions that they are trying to tackle themselves. So I encourage everyone who's listening to spend the time to go through these story maps to have a browse of the data that we have. But what I really wanted to show here is actually our pharmacy care desert dashboard that I've also made available at the county level. All right. So, see, as a public health analyst at the Maryland Hospital Association, using that hat, within this dashboard, I can select a specific state to see both where the pharmacies are with these yellow pharmacy locations, as well as the map underlying it shows the pharmacy count by county. And so you can also do different filtering by using the pie chart, which I think is pretty useful. Allows a nice way to filter some of the data there. You can also select specific counties within the state of Georgia as an example, and if you wanted to do a regular drop down to select the categories of pharmacies, you can as well.
Yeah, let's not gloss over that, Paul. I mean, you mentioned that this is work done in Maryland, and yet we have the data and the analytics for Georgia. So this is actually a nationwide analysis. Our care desert analysis is nationwide, meaning that we can assess the access and the locations of healthcare facilities by service line across the country, and therefore tell which areas, whether it is counties, zip codes, census tracts again, have sufficient access to care, insufficient access to care, and then what the implications are that there are communities that don't have enough service providers or enough facilities to meet their healthcare needs. And we stress this because, of course, healthcare access is really the first part, or the existence of healthcare facilities in order to provide care is the first part of healthcare access. It's the first step when thinking of health equity overall. You have to have access to care in order to be able to deliver care to all people. This is, again, another reason we're interested in making this available to anybody in California who would want to know this information, so that it could be assessed in light of the fact that, of course, in addition to homes, the wildfires in LA and San Diego and Southern California overall will have impacted the healthcare infrastructure as well. So as communities rebuild, they'll have to keep in mind, and it actually provides an opportunity to build the necessary healthcare infrastructure to meet their needs as a society, as a pretty large level of population that lives in Southern California.
And definitely, thank you for that, Ajay. And once again, dashboards can be challenging to interpret without previous experience, or at least spending some time playing around with them. And so I do have another query that I would like to share with the audience. So, as with my public health analyst at MHA Hats, I would like to know what is the average distance to a woman's health clinic in Maryland at the zip code level for 2024?
So while that comes back, Paul, you in both of the Anna examples, you've specified zip code, right? Even though it could be other areas, right? What happens if the user doesn't specify the region or the geography on which they're asking? Does Anna just ask you to make that selection?
Yeah, that's a really great question. So, with the way I have Anna set up, it will, for these kind of core attributes like year and geographic level, whether that be county, zip code, census tract, states, there are default values that Anna utilizes if those parameters, those attributes aren't passed through. So I believe for the US, it defaults to county if you don't specify. And for year, it will default to the most recent year in which that we have data.
Great, and that's another thing that I wanted to specify. Right, we know that data changes. Some changes moment to moment, some changes on an annual basis, and other data may change even more slowly than that. So we do have the opportunity to allow users to specify which set of data that they want to use, whether it's on an annual basis, whether it's a data set from a particular use. There could be reasons why they want to make analysis against one set of data, one iteration of data versus another. For instance, the census is done every 10 years, and then it is estimated in the intervening years. Some use cases may want the latest estimate, and some use cases may want to know based on the last decennial census, right? That is a option. That option is available to users.
Yep, that is very true. So as we can see from the response, it's good that you brought up the different geographic levels, because I will have a toggle for this because I can agree it could be kind of annoying that it being there all the time. But you can see at the end of Anna's response, it mentions that this analysis, this data, is available for various geographic levels at the zip code, tract, and county levels, and it also mentions the extent of the analysis. So for this specific set of data, it's limited to just the US, the entire US. So that's what it's available for. However, we are looking to expand it across different continents and countries as well. So from the text response, we do see that the average distance is 18.89 miles. So it's great to be able to get that instant kind of answer to my question. I don't have to go around, pull data, do calculations. I can just ask this question and get an immediate answer. And then again, not only do I have the answer, I can then see what the distribution of that distance is. As we can see, we have very low distances in kind of more of the central Maryland area. But then as you get a bit further out towards the Panhandle, and as well as the Eastern Shore, we can start to see where you start getting much longer distances to care for, in this case, women's health clinics. And they also have all the same sort of filters, state, county, as well as the pie chart shows the distribution, and the table with the underlying data as well.
Wonderful. Right, and I think you mentioned in there, Paul, that there are features you're adding. So I think everybody knows that, right? There's no technology solution is truly in a final state. There's always advances that are coming down the line. So we talked about a lot of stuff already today, right? Disaster response, care deserts, and more. So where do you see the future taking the GeoMD platform and its generative AI interface? What's coming down the road?
Yeah, that's an excellent question. So with Anna, we are continuing to add our indicators, our backlog of indicators, as well as continuously improving its efficiency, as well as expanding the types of questions that it can answer in relation to the uh, indicators and data that are within the GeoMD platform. One,
Right.
one,
Well, let's go into that for a second, right? So you're that's interesting, right?
mhm.
So we have collected and curated a broad set of authoritative data relative to factors that influence health outcomes. Everything from census data, satellite data, population dynamics, climate and environmental data, and many more, right? Those data also feed the analytics that we've developed, but users are not limited to analytics that we've developed.
That is
They
correct.
users can certainly have algorithms of their own, they can have use cases of their own, and they can leverage our infrastructure, our platform, to enable them to understand how health risks impact their operations. Right? They
Yes.
may have specific data relative to their operations that they want to include, or they could just simply take the output of algorithms that are ours or theirs that they develop with our data and inject it into their own risk management uh, platforms or software solutions. So it gives the overall platform provides a lot of flexibility for general health risk management, and you're certainly not limited to the areas, even though they're the areas where we've done some work are quite broad. You're not limited to the areas where we've done some work.
Yep, that is very true. So in addition to uh, those updates to Anna and Anna's general flexibility, because I did build it with a kind of a focus on being able to integrate with client systems as well. We also have plans a advanced version of the Anna interface that we are calling the Anna Geospatial Explorer, and
Yes.
it combines the generative AI based orchestration functionality and conversational interface with the powerful functionality that you get out of geospatial analytic dashboards. And so our vision is that AGEs will enhance both the depth of data included and the speed of the analysis, allowing for more responsive actions that are better aligned with the needs of clients.
Fantastic. So I know we're going to save AGE for another episode, right? But let's exit on this question then, this episode, and I certainly will want to thank everyone for tuning in and listening, and please share questions, thoughts, criticisms, everything with us through our social media channels on LinkedIn or Twitter or X, email, website, everything. But our exit question, sort of, the platform and the interface dashboards that you've shown are user friendly. At least we believe feedback we've received is that they're user friendly and they're powerful and they're clean. So, what's the advance that you anticipate AGE will provide to the dashboards that Anna is already producing today?
Yeah, so I think the easiest way to convey the advance is as we saw with Anna. I'm not going to bring it up again. As we saw with Anna, um, you have the kind of separate map, pie chart, and table components as their own separate tabs, with the primary focus being on the text. With AGE, how I envision it is you have the chat, but then you have for the visualization side the full proper dashboard, and AGE will be able to, based off your query, populate the dashboard with relevant information based off your query, and I envision it having a much deeper interconnection between the dashboard and Anna, where you can ask questions of the data within the dashboard in and of itself, and Anna will be able to perform relevant calculations based off of that information or relevant filtering to give you those sorts of answers. So it ends up being an additional aid while you have the full access of the full capabilities of a full geospatial dashboard in front of you as well.
Great. We're excited. We're excited about sharing that with the world and in the near term.
Definitely.
Well, again, let me thank the audience. This is Ajay Gupta and Paul Churchard, HSR.health, for episode 3 of the GeoAI Podcast. Future episodes will be coming at least on a monthly basis and maybe more frequently, and we are happy to bring in guests as we have done in our past episodes and talk about projects that we do, projects that you do, or projects that we're seeing going on in the industry. For instance, there's been, some of you may have heard, a new $500 million investment into essentially advancing AI infrastructure to do things like mRNA vaccines for cancer or surveillance technology. What does the world think about that? We'd certainly be interested in talking about how GeoAI could play a role in that kind of AI-based surveillance mechanism that has been talked about as Project Stargate.
Yeah, definitely. I'm really excited to see all of the progress that ends up coming out of that program and seeing all of
Correct.
the innovations that we can take advantage of in our use case.
Correct, because
For our
it feels
clients.
a little bit like you're talking about surveillance of AI-based surveillance, which just really means a lot of computational power, a lot of distributed computational power to do that. It feels like that's integrated with the creation of a digital twin of the area, of the world, right? So that's something that's going to be an interesting conversation for the future.
And I look forward to that conversation.
Do I, Paul? Until then, thank you, everyone, for listening to the podcast.
Thank you very much, everyone. Have a great rest of your week.